Join the movement to build healthier communities. In this episode on Beyond the Surface, public health expert Gloria Shusha will share her insights on preventing diseases, promoting wellness, and creating a brighter future for all. From the importance of epidemiology to the critical role of caregiving, Gloria will take us on a journey through the complex world of public health. You will learn how small changes in your daily habits can have a profound impact on your community's health, and how collective action can drive meaningful policy changes. You will also discover the surprising ways that public health affects every aspect of our lives, from education to economy. Feel welcomed here on Beyond the Surface.
Thank you.
First of all, can you introduce yourself so that the audience can know you better?
My name is Gloria Shusha. I stay in Brantara at Maketa. HD, I'm 23 years old. My education background, I am a holder of diploma in public health obtained at Domasi Institute and Management and Technology in 2023.
All right. Before we start our discussion, you are a holder of diploma in public health. So be versatile in the areas of public health that you cover during your education at Domasi Institute of Management and Technology. All right. A quick introduction to public health. What's the definition of public health?
Public health is the science and art of preventing disease, prolonging life, promoting health and efficiency through organized community efforts.
That means you work with people from various communities.
Yes.
All right. What are the importances of public health?
Public health plays a vital role in ensuring the overall well-being of individuals, communities, and societies. Here are some key reasons highlighting the importance of public health. Prevents disease and injury. Vaccinating programs prevent infectious disease. Health education promotes healthy behaviors. Injury prevention measures reduce accidents. 2. Promotes health equity. Addresses health disparities among vulnerable populations, ensures access to healthcare services, advocates for policy supporting health equality, protects population health, surveillance and response to outbreaks, environmental health regulations, disaster preparedness and response. 4. Improves quality of life, supports mental health and well-being, encourages healthy lifestyle, and enhances community engagement.
All right, that's great. So that you are doing a lot of stuff with the community. All right, what inspired you to pursue a career in public health?
My inspiration to pursue a career in public health is to work with people in their communities by telling them how to prevent diseases and how to prolong their lives.
Yes.
Yeah.
Okay. The diseases that you can work with community members that easy to tackle. Maybe I think waterborne diseases.
Yes.
Like cholera,
yes.
bilharzia, and the like.
And also assisting under 5 kids, helping to giving them vaccines,
even proper nutrition,
guidance. Yeah, and counseling. Yeah, telling them how can they handle to be safe in their in the various diseases.
All right. Now, let's see what's the most pressing public health issue facing by your community.
The most pressing public health issue facing local community vary depending on factors such as location, demographics, and socioeconomic conditions. However, here are some common and significant public health concerning that local communities faces. Firstly, we have access to health care, mental health, chronic disease management, infectious disease outbreaks like COVID-19, substance abuse, food insecurity and nutrition, environmental health, for example, air and water pollution, climate change and natural disasters, violence and injury prevention, maternal and child
what?
health.
All right, that means that in your local communities, there is lack of hospitals like health centers and lack of organization to counsel people on mental health as well as environmental health.
Yes, of course.
The problem lies from the government. That's it.
Yes.
All right, here in Malawi, outbreak of infectious diseases is relatively high and rapidly spread. What are the examples of infectious disease that outbreak easily in your area?
Infectious disease outbreaks occur when a pathogen, bacteria, virus, fungus, or parasite spread rapidly among a population, often exceeding expected levels. Here are examples of infectious disease outbreak: flu, malaria, polio, cholera, bilharzia, COVID-19, and smallpox.
All right, then, how do you handle or overcome that outbreak of these diseases?
By avoiding these outbreaks.
Okay.
By avoiding these infectious disease outbreaks, we go in the community and tell people how can we prevent the diseases. Yes, like we tell them
on how to remain free from diseases.
First of all, like for example flu, we tell people to stay free from dusty, and the disease like malaria, we tell people to sleep under the mosquito net, and for example COVID-19, we tell people that we should wear face mask and social distance
as
from
well as,
one another,
as well as avoiding handshakes so that we can prevent the disease to spread.
Yes.
What about cholera?
Cholera, we tell people how can they take care of themselves, like cleaning their homes. Yes. And the cholera, we tell people to dispose their wastes in the bins and dig pit latrines.
All right, we know that incidence and prevalence are two different things in words. What's the difference between incidence and prevalence?
Incidence refers to the number of new cases of a disease or condition occur within a population over a specific period, while prevalence refers to the total number of existing cases of a disease or condition within a population at a specific point in time.
All right, that means a good example of differentiating incidence and prevalence is that of past 2 years, the case of COVID-19. We collect data of that almost 1,000 of people were affected by COVID-19 disease, and that means that that was the prevalence, and the incident were data collected day by day.
Yes.
We have a statistics of that Maketa area has a problem of cholera. What's the incidence of cholera in Maketa and prevalence of cholera in Maketa?
Incidence here in Maketa, we have 5 cases in a day
Affected by
cholera.
Yes.
And while prevalence, we had more cases, like 7 cases.
7 or 70.
70 cases.
That's the prevalence rate of people affected by cholera.
Yes.
All right. Moving forward to water, sanitation, and hygiene. Wash. How do you observe that there is water, sanitation, and hygiene in Maketa area?
By civic education, going in the community, telling people how to clean the water.
By applying like water detergents like chlorine,
Yeah.
water guard,
Yes.
as well as chlorine dispensers, applying them near by the water boreholes, wells, as well as taps.
Yes.
All right. What's the importance of wash in public health?
Importance of wash in public health. It helps people to live healthier lives. Yeah. 2, it helps people to prevent diseases like cholera. Yeah.
Yes, yeah, which are waterborne
diseases. Yes.
Is there any impact on the your health care services at the health clinics?
At our health center, we have small people because people are not suffering from many diseases like cholera.
Yes. All right. On the other hand, what are the consequences of poor water, sanitation, and hygiene in your area?
There are many consequences of poor wash.
Yes.
Yeah, like people utilize money for transport, and they save more money like buying expensive medicine. Yeah. If many people comes at our health center, the resources
Of the health
center is high.
All right. To improve water, sanitation, and hygiene, what strategies do you implement to improve wash?
There are many strategies for improving wash. Firstly, water treatment. We have strategies like toilet construction and maintenance, and we have strategies like waste management and proper disposal, and we have strategies like promotion and education, and strategies like an opening defecation elimination.
Don't you encourage like campaigns?
We do campaign by telling people how to promote their lives by hand washing campaigns, soap, water and hygiene education, person hygiene education, showering like bathing, food handling and storage practices.
All right, community members, what laws and responsibilities they have to contribute on improving water, sanitation, and hygiene?
Everyone has a responsibility to take care of their lives by conserving the water and water bodies. by civic education, telling other people how they can handle water, as well as promoting their proper waste disposal,
so that the waste cannot pollute the water bodies. Now, let us look at health impact assessment and nutrition of the general public. Can you define the term health impact assessment?
Okay, health impact assessment is defined as the process of identifying the future consequences of the current or proposed action.
All right, that's what health impact assessment is all about. All right, now, what are the importance of nutrition in public health?
Importance of nutrition in public health. Firstly, prevents deficiency disease like kwashiorkor, rickets, marasmus, beriberi in children because they eat well balanced diet food
Health workers.
as instructed by us as public health workers. The second importance of nutrition in public health is promotes health by supporting growth and development, as well as improving mental health.
All right, nutrition is guided by key principles of healthy eating. What are the key principles of healthy eating?
There are many key principles of healthy eating. For example, people eating foods that are rich in nutrients like proteins, carbohydrates, protein, and calcium, as well as by hydrated drinking plenty of water to hydrate the body, as well as limiting the
unhealthy foods. I just said that public health workers are responsible for caregiving fundamentals. How do you observe that health workers, which are of public health, are doing caregiving fundamentals?
A caregiver must follow these core principles: respect and dignity and communication, and therefore must follow these core principles: caregiving skills, and should have emotion and social support and caregiver well-being.
That means that a caregiver should have humanity in general. What are the laws and responsibilities assigned to a caregiver?
A caregiver roles and responsibilities vary depending on the care of patients' needs, caregiver relationship, and care settings. Caregiver roles and responsibilities include person care by bathing, dressing the patient. On the other hand, mobility assistance such as transferring, walking, and medication management, and nutrition and hydration support, and households management, laundry cleaning, and stress management and relaxation techniques.
All right, a caregiver, what are his or her requirements for self-care?
A caregiver must have person hygiene in order to prevent diseases from other people.
Transmission from him to the patient.
As well as supporting the patients in spiritually, in mentally, by telling them how can
They
lead
improve their
improves
health.
their health.
and by also sharing them the word of God, they will be encouraged a lot. All right, according to you, what are the importance of self-care for caregivers?
1, it reduces stress.
Yes.
2, improves mental health and mood. 3, enhances physical health. 4, it increases energy and resilience. 5, supports better caregiving.
That's essential indeed. Challenges and setbacks are there in a caregiving process. What are the most significant challenges faced by caregivers while treating the patients?
The most significant challenge faced by caregivers: stress and anxieties. 2, emotion overload, and feeling overwhelmed and trapped.
Which are related to the emotions.
Yes. And we also have social challenges: social isolation and loneliness, strained relationship with family and friends, lack of support and resources, difficulty maintaining social connections, and feeling disconnected from community.
All right, that's empathetic to hear that caregivers face challenges emotionally and socially, as the community discriminate them from even chatting, All right, you as a caregiver, how can the communities support you or caregivers?
As a caregivers, we need support like physical challenge,
Physical support, emotional
support, financial support, as well as social support, so that we should not feel loneliness.
All right. In every occupation, there are laws and ethics, laws that are body of laws and regulations, while ethics are code of conduct, so that public health workers can follow for a better work conditions for them and the patients too. What are the laws and ethics available in public health that public health workers must follow?
We have public health laws. Firstly, we have constitution laws, which consisted by authorities and limitations. Secondly, we have administrative law, which is consist agency, rules and enforcement. And we have tort law, which is consist liability and negligence. And lastly, we have international law, which is consisted global health treaties and agreements.
All right, so that if a public health worker break the laws, he or she face legal authorities.
Yes, if a public health worker breaks the laws, he or she must face legal
procedures,
as
he or she has not respect the laws of your occupation.
Yes.
All right, now let us look at the ethics of public health.
Ethics in public health.
Yes.
Yeah. Respect for autonomy, do good, do no harm, fairness and equity, and dignity and human rights.
That's true, such that most patients have grievances about mistreatment about public health workers in various health centers. All right, following laws and ethics in public health, what are the significances of following laws and ethics in public health?
Doing so in public health, it enables ensuring that policy programs and research prioritize well-being, dignity, and human rights of individuals and communities. Here is why ethics are important in public health. First, it protects vulnerable populations by ensuring equal access to health care, safeguarding children, elderly, and disabled individuals, and addressing health disparities and inequalities. 2. It promotes social justice by addressing systematic inequalities, advocating for health as a human right, and empowering marginalized communities. 3. It respects autonomy through informed consent in research and treatment, protecting individuals' freedom and choice, and respecting cultural and personal values. 4. Transparency and accountability is enhanced through opening communication and disclosure, accountability in decision making and resource allocating, transparency in research methods and findings, and lastly, fostering trust and collaboration by building community trust and engagement, collaborating with stakeholders and partners, promoting interdisciplinary approaches.
That's great initiatives implemented in public health so that the community and other communities, the general public, should have a better health for their lives, especially children which are vulnerable and prone to diseases. All right, before we conclude, what are your final thoughts and advice to the community and your fellow public health workers?
As a public health expert, my final thoughts and advice to ensure healthier communities are: prioritize prevention, foster collaboration, address health equity, emphasize community-centered approaches, stay informed and adaptable, invest in public health infrastructure, advocate for policy change. Everyone in the community has responsibility to do all these activities, as well as my fellow workers, for a brighter, healthier future.
Alright, that's how we wrap up our today's episode about healthier communities for healthier lives. Thank you, Gloria Shusha, for your time, for allowing us to have a conversation with you.
Welcome.
Alright, our audience, that's how we have concluded. We have reached to an end of our today's episode. Don't forget to like, subscribe, share, and comment by accessing our online platforms on Spotify and YouTube by just searching Beyond the Surface. You will find our episodes there. Thanks for your time for listening. Until we meet next time. Bye.